and welcome to your new grad interview. How are you, Shylee?
I'm good, thank you. How are you?
I'm really good. I'm really excited about this interview. It's a shame we can't meet in person due to COVID and everything, but I'm sure you're going to do really, really well.
Thank you.
No worries. So for today's proceedings, we have 3 sets of questions for you. They're just going to give us a really good idea of how you'd work within a hospital and just give us a good indication about the kind of nurse that you'll be with us. Is that okay?
Thank you. That's
No
great.
problem. Awesome. So are you ready to start with the first question?
Yes.
Okay, awesome. So considering the NBA stances of practice that govern your nursing practice, how will you deal with the following situation? It is your first rotation as a new graduate nurse in the cardiac unit. You respond to a patient call. When you're entering the room, one of your patients was complaining of chest pain and another confused patient was trying to climb out of bed. How would you handle this situation? Reflect on how you would handle the stress of the job.
Thank you. Okay, so on entry to the room, I would call by pressing the staff assist button. As both of these are my patients, I could only be with one patient at a time. So by asking help from my team, I would assist with the cardiac patient and ask my team if they could just be with the confused patient that's trying to climb out of the bed. I would immediately start with my doctor's ABCD for the cardiac patient, eliminating any danger for myself or colleagues or neighbouring patients. So yeah, I'll be starting with the airways of the patient, breathing, circulation and disability. The patient has said he's got a chest pain, so I'd be evaluating that pain score and seeing if this needed to be a MET call or a registered medical officer to attend immediately. If any of those observations weren't within the flags and the chest pain was 5 out of 10, it would be a MET call. If it was below 5 and OBS all within the range, I'd still get the registered medical officer to come and review for me. I'd also be adhering to the hospital's policies and procedures and following any of the ward's instructions. I'd be asking a colleague if they could bring in an ECG machine for me. Staying with my patient, making sure my patient, keeping them calm, having open communication to what is going on, and yeah, reassurance there. Being on a cardiac ward, that I may have to adhere to a pathway of acute coronary syndrome assessment. That's known as a PACAS flowchart. And if that was appropriate, I'd be using that for the ward. I'd also be checking my patient's medication chart, seeing if there was any medication due or if there's any PRN medication that we could give for the chest pains. I would follow the direction of my team and of my medical team to what is going on. And also, after the, if we've administered some pain relief, I'd always still be staying with the patient. And if a secondary survey was needed to be conducted, I would do a thorough check on my secondary survey. And we do a secondary survey because after we've given pain relief and we've assessed and there'd be some changes we're hoping in, you know, the airways or the breathing or the circulation. So that'd be why I'd be doing the second survey. Once stabilised, I would debrief with both of the patients individually, maintaining privacy and confidentiality with them both, with an open communication of what has happened and what the recommendation would be. If need be, I would phone the families or next of kin and just let them know what has happened today, and with the outcomes of the patient. I would recommend that the patient that was confused, making sure that we had he or she's bed lowered for safety, and even some safety alarm pads, if appropriate, on the floor to indicate when the patient does climb out again. I would be debriefing with my staff members, any multidisciplinary team members that were involved, and also with my NUM. I would do a self-reflection that I like to do at the end of every shift. That way I would know if there's anything I could have done better, and any input from staff members that could help me. As being a new grad, I love all the feedback and need the positive with the negative feedback to make me a better nurse. Documentation would also be done in both of the patient's files, and yes, so that's
really good. That was a very thorough answer. Thank you for that.
Thank you.
No worries. So the second question. Nurses have to comply with occupational health and safety standards. Describe a time you had to deal with an unsafe situation and what actions did you take?
Thank you for that.
No.
So I had a situation once working on a ward. It was a double room, so two patients, and my patient, I had administered Clexane. And then after administering the Clexane, I had to dispose of the needle into the sharps container that was mounted on the wall. When it was quite high and you couldn't see the opening, so I put my needle into the sharps container. And when I did this, I was pricked with another needle that was hanging out of the sharps container. It was another Clexane needle. So immediately, as I was wearing gloves, I pulled out the needle, took off my glove, ran my hand under warm water, and then did, as per protocol, is needle stink injury. I squeezed the blood out around the puncture, encouraged it to bleed, then held my hand under the water for 5 minutes and then washed the area with soap and covered it with a Band-Aid. I then had to, I notified my team leader and NUM straight away of that, and I was taken down to have some bloods taken myself, and had to have some counselling and some to be followed up with some more blood work to be done. But in the meantime, communicated with both those patients in there. It was an open disclosure with them both what had happened to me, and we at the hospital had to then do a thorough blood check on both these patients to get their history of and any current results that we would need. So they both gave consent for this to happen. So that was a bit of a waiting game to get that back. Fortunately, everything was okay. These two patients, nothing came back that was needed to be followed up for myself. I just needed to follow up at 2 weeks later with another blood test, and then 6 months later. And then so from that, an IMS was entered and documentation was adhered to as per hospital policies and procedures. So with that under investigation and the IMS being put through, it was found that the the Sharps box mounted on the wall was way too high, and it actually was a danger. So they removed it and lowered it to another eye height, so you could see what was actually in that container. So yeah, it was moved to an appropriate height to avoid any further incidents. Thank you.
Wow, thank you for that answer.
Thank you.
So, question number 3. The completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a lifelong of learning and autonomy. After obtaining employment, what are your short term within the next 6 months to a year, and long term within 2 to 5 year career plan or commitment to professional development?
Thank you. I love this question. I am so passionate about nursing. I feel like nursing found me, and I didn't find nursing. You know, my goal for the next 6 to 12 months is to complete my new grad placement and to gain as much knowledge and skills as I can from my co-workers to my educators, and from my NUM, just absorbing everything that I can. I'm extremely passionate about critical care nursing and hope to gain employment in ICU or emergency after my new grad. I currently do extra shifts in emergency hospital at Liverpool Hospital, and I've been fortunate enough to do secondments in emergency, and this exposed me to the acute and critical care nursing that I found my passion for. I also completed a 2-week placement for UWS not so long ago, and that was 2 weeks in ICU at Bankstown Hospital. And I was just in awe of those nurses, the amount of knowledge they know, and you know, the critical care nursing that they did. I just knew that that's where I knew to be, I wanted to be, and my passion you know, just oozes when I even talk about it. Therefore, my goal for the next 2 to 5 years was to continue to study, and I would want to be enrolled or completing my postgrad nursing degree in critical care, followed on then by my master's. By doing that, my career goal, you know, for 5 years is to be a CNC or a CNE in the hospital, and to become the best nurse that I can be, and to continue to grow and develop. By doing this, I would love to share with other nurses my passion, my education, and my knowledge, and to follow their dreams. Yeah, but most of all, it's to get through this year as a new grad, and, you know, like I said, be a sponge and grab as much nursing experience and as much knowledge, looking at the resources and research that's out there, and just continue to grow into an amazing nurse. Thank you.
That was beautiful. Thank you so much for your time. I really enjoyed getting to know you better, and the love that you have for nursing. So hopefully we get to see you soon. Thank you so much.
Thank you so much. Talk to you later.
No worries.
Bye.
Bye.